welcome back. So this is a vlog where I'm attending a 2-day conference, Concordium, which is held at Amala Institute of Medical Sciences. I reached there by bus, and yeah, what you see here is the college, which is one of the most renowned institutes in Kerala. And yeah, I was looking forward to it. The registrations happened, and then we moved ahead to our first workshop, which was a crime themed forensic workshop where we had to put our forensic knowledge to work and find out who the murderer was. I wasn't able to film a lot because they took our phones. The second workshop was with Breathe Easy, so we learned procedures like bronchoscopy, laryngoscopy. So this is my procedure.
So it is the lip space.
Next it was a spirometry session where I monitored a spirometry test. Then it was non-invasive ventilation, the different kinds and what are the indications and contraindications for that. Then it was time for lunch, so there was just fried rice and chicken. And then the most awaited part was our debate. So these were the different teams. And
social media helps us to quickly find. I'll be speaking for the notion. Social media are cloud techniques to women. As both my friends very beautifully summarize both sides of the coin, what I like to start with is that people and also people are in the world everywhere. The range of which is evolved to such an extent that all the information in the world is available. And at the time, the social media like Instagram contains the thing made by AI. Such snapshots are required when this information that is propagated to us comes from reliable sources. One of the main things that is missing from health information that is constantly forwarded to us through different social media is accountability. What are the information that is being provided in social media? As you know that social media is expansive, many companies are not able to provide physical information that comes from it. But something in inspiration can be not in the law, the laws that relate to water pollution. If you are polluting a water body, not only is the person who is responsible for polluting the water body is held responsible, but also the person who is regulating and the authority who is under the water body comes. So I feel like the extent of punishment should lie in the source itself, but there should be some repercussions for the social media company also because they have enough resources. Because they've been able to do so many spam accounts that are actually generous. If they put this resources to actually help and related to the health information, then it would be something that could be rationalized either in the government level.
the debate got over, and unfortunately we didn't move to the final round, but that's okay. We then had our inauguration of the event, which was also quite refreshing because the Chancellor of Kuhas had come, and then there was the welcome address, lighting lamp and all of that, and the program was officially inaugurated. This is someone I know, Hiii. I mean, she is the coordinator of this event. She's done a fabulous job. Now this is the third workshop, the one I was so excited for because it was stitch, click and repeat. And this was the sir who was just explaining how kinesthetic intelligence is important in surgery. The first station in that was catheterization, which is a skill that all interns must know. And it is done routinely in hospitals, and the different steps were explained. We then moved on to an interesting session, which was the stitching session. We learned the normal stitch, we learned the mattress stitch, which had vertical and horizontal mattress. This was my stitches, and this is the girl who was sitting next to me who was stitching so beautifully, so I just had to take a clip. We then had the laparoscopic part of this workshop where we were having simulated laparoscopic experiences. So fun. This was the beautiful sky that day in the evening, and the cultural event started.
These after hours.
believe that is right. And we are human beings, not just started this debate. And we have already moved past them. You're talking about making patients' decisions for them when they are still alive. I literally cannot believe how my working outcomes can justify this point.
There are a lot of reasons behind that. People come to us for opinion quite late. Our population is slightly more younger, and the onset of the disease is younger in Indian patients, and we tend to have other.
There are going to be two answers. For red, there is going to be an intervention if there are resources, and at other times it is going to be an yellow, or even at times it is going to be black. So for the first case scenario, a 3-month-old. So you are ready to go first. So this team will be waiting outside.
WhatsApp
കഴിഞ്ഞു ICD ഇട്ടപ്പോൾ അറസ്റ്റ് പോയി നമ്മുടെ സ്ഥിരം Yes sir, yes sir.
So basically, my mind is also revolving around antimicrobial resistance and stewardship. As Dr.
We start a heart day. What's the theme of that? Yeah. First aid and sports.
Now it's time to welcome our esteemed quiz masters, Dr. Anthony Kaketh and Dr. Sangeeta Sachin.
Team A, TVF Team 2.0, PK Das Institute of Medical Science. Dr. Fida and Dr. Tanuj.
Chances for Team A. So you can select a domain from the 5 domains.
Your privilege to select a topic. Too easy.
Next question. Dioxin is extracted from which flowering plant?
Jeevan is trying to answer, but it's
Which plant? Time starts. Identify the person. Robert Cook. Correct.
correct.
Pelegrinus due to
Correct. Tell him Mike.
antidote of benzodiazepine toxicity.
Correct.
Disease detected in Thales amoebas. Dyslexia.
Correct.
Murphy sign is seen in. Correct.
Correct.
Identify the lesions.
Cotton wool spots.
No.
Name the fracture. Correct.
Correct.
The polyvalent HV available in India is effective against seed-like evolution. True or false?
False. Correct answer.
Components of bed trial.
Hypotension, absent heart sounds, elevated JVP.
Correct.
Correct.
Identify the lab.
MST, non-stress test.
Correct. 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 Revisit.
Plain English.
So this was choroid tubercle seen in tuberculosis.
Choroid tubercles. It is most scientific term.
So finally, TVF 2.0 has 170 points.
170 points.
Surgical.
To the winners, PK Das, Dr. Vida and Dr. Tanuj. They are the judges.
It has been 2 days of
Thank you.